I am Dr. Umer Khan, and I have been in healthcare IT and tech for over a decade now. And I've seen how often healthcare professionals are using AI tools without really understanding them. So today's topic is one of the most important topics if you want to be more than just a button clicker in the world of AI. And this, my friends, is model architecture in healthcare AI. If you, my friends, if you can discuss AI model architecture in a healthcare setting, you stop actually being a passive AI user and you start being a person who shapes and develops safe and effective AI systems. And that's the human in the loop. And that's the future leader in healthcare. And if you want to be a future leader and not be left behind, then watch this video. Understanding model architecture empowers you to ask the right questions when AI tools are being implemented in your clinical setting. You can evaluate whether the chosen architecture is appropriate for the clinical problem, whether the model's capabilities actually align with your clinical needs, and whether the system's limitations are properly understood and communicated. And these questions are what you need to know when you're talking to any vendor or if you are looking to design your own model. And this knowledge, my friends, also helps you identify when AI recommendations might also be unreliable. If you understand that a model was trained using let's say, a feed forward architecture on static data, I'm going to talk about all of this in detail. Just to give you an example, you will know to be cautious about applying its recommendations to patients whose conditions are rapidly changing. You cannot use this in an ICU setting. If a convoluted neural network was trained primarily on images from one type of scanner, you will be appropriately skeptical when using it with images from a different piece of equipment, even if, for example, an MRI machine, it's 1.5T versus a 3T MRI scanner. These differences can make a huge difference. And more importantly, understanding model architecture helps you maintain appropriate clinical oversight of these AI systems. You become the healthcare professional that can ensure that AI actually enhances rather than replaces clinical judgment, which definitely has a role here, and who can identify when human expertise is needed to interpret or override any AI recommendation, and who can help design AI systems that truly serve your patients in your clinical setting. And that is very important. And the future of healthcare AI depends on professionals like you who understand both clinical practice and the technology that's increasingly supporting it. Now, by mastering these concepts, you position yourself not to just use AI tools, but to shape how they are developed, implemented, and used in healthcare settings. And this is more than just professional development. It's about ensuring that AI in healthcare serves its ultimate purpose. That is, improving patient care while supporting the clinical expertise that remains irreplaceable in healthcare delivery. So let's be a little bit more specific. Interpreter, you can have an interpreter role. You can help translate AI outputs into clinically meaningful insights, understanding how architecture influences predictions and their reliability. And we'll talk about reliability in a soon upcoming lecture because there are a lot of KPIs that we need to actually work on. But probably we will not cover that in this lecture. Then designer helps shape AI systems that truly serve patients and clinicians by providing input on architectural choices and clinical workflows. Validator, a very important role is of a validator. Identify when AI recommendations might be unreliable based on architectural limitations or their training biases. And then overseer. So all of these roles are fairly important. Maintain appropriate clinical oversight because this has to be continuously done even after rollout, especially after rollout, and knowing when human expertise should override AI recommendations. So just want to quote over here, the future of healthcare AI depends on professionals who understand both clinical practice and technology and the technology that supports it. Now, neural networks, my friends, and neural networks are the foundation of healthcare AI. And at its core, a neural network is a set of interconnected nodes. And all of these are called nodes. All of these are called nodes. And we can also call them neurons just in the brain. And they are arranged in layers. You can see layer here, input layer, hidden layer, another hidden layer, another hidden layer, and then you have the output layer. Data comes into your input layer, gets processed in your hidden layers, and it could be one or more than one. The more hidden layers you have, likely the more complicated your model is. And then you get results in your output layer. So this might sound abstract, but in healthcare, this architecture is basically what is really making life and death decisions every single day while using AI. Now, imagine a neural network taking a patient's age, lab results, vitals, and symptoms, then outputting a probability of sepsis much before when a doctor will be making the decision. And we keep on talking about the sepsis example because it's fairly common and a big issue in healthcare. So imagine this, right? This architecture, how many layers, how many neurons are connected, and what activation functions are used determines how well it can capture complex relationships in the data. The bigger the data, the more neurons, the more layers it is able to capture complex relationships, the more you have all of these aspects. Now, this isn't just academic theory. This is the technology that's already being used to, let's say, flag high-risk patients in emergency departments all across the country. Now, let me give you a concrete example from the Vanderbilt University Medical Center. Well, they use something called logistic regression, and I'm going to talk all about this in detail, which basically is a statistical method for binary classification problems, where the goal is to predict the probability of a binary outcome, meaning yes, no, or true, false. And let's say, for example, they basically try to assess re-intubation after surgery. So patients get intubated for surgery, and intubation means that they have a ventilator connected and their breathing is controlled and assisted artificially. And there's a huge problem in the ICU and post-surgical units where you don't want to take out the tube and then the patient needs to be put back on the tube because the patient cannot tolerate and the patient cannot breathe on his or her own. So this is a huge issue, and predicting this precisely or getting the right numbers where you need to extubate the patient is very important. And this could result in poor outcomes for the patient if you don't calculate this properly or you don't identify the risk factors appropriately. This could result in re-intubation, and that could lead to poorer outcomes for the patient. So we, of course, don't want that. So figuring this out was a big issue and is still a big issue in a lot of areas all over the world. Now, this model that they worked on actually was through neural networks. So input variables like sedation, drug dose, respiratory rate, extubation time, heart rate, oxygen saturation, different ventilator settings were all inputted into this program. And the model was actually able to predict better than usual care about what factors actually play a bigger role in preventing re-intubation for these patients. And this was a huge improvement in their care that they were able to deliver to their patients. So this is just one example. And I mentioned in this picture, let me just show this to you guys again. Dear all, I hope you are doing great and that you are liking these lessons and you are enjoying and you are learning. And I did want to suggest something as an option for you. Only if you are one of those who want to have this content in a more organized manner, there is a program that I have set up that you can find in the description. It absolutely is not necessary. However, it is only for those who do thrive in an organized approach, and there just might be a few more goodies there as well. Anyways, I wanted to share this, and now back to the video. That you could have multiple hidden layers, and the more hidden layers, the more complexity it could handle. But complexity itself is not your main goal in this situation. But just to give you the basics of neural networks, a simple forward looking network with only one hidden layer might miss complex interactions between medications and, let's say, the patient's physiology and the patient's vitals. A deeper network with multiple layers might capture these interactions but become so complex that you can't really understand why it is making a specific recommendation. So the more complex you make it, it might be a bit more difficult for you to actually understand why is it giving you that answer. And that, of course, is important in medicine. And if the randomized control trial demonstrates that the AI algorithm actually has produced better results, well, then it's probably a thought that, hey, yes, let's look at the AI model and look to follow the AI model a bit more, and then look to validate this further. So still, creating more layers does lead to more complexity. However, your ultimate goal is better patient outcome. So even if you're not able to explain, I mean, this is an ethical consideration. If you're not able to explain, are you still going to use that platform, that model? Well, that's up to debate. A lot of people will say yes, because if it's proven to produce better results, then why not? So this is where your role as a human in the loop becomes very critical. You need to understand enough about the architecture to ask these right questions. Is the model complex enough to capture the clinical relationship that matter? Is it so complex that we can't trust its reasoning, even though it may be giving you some good results? And does the architecture actually match the type of problem that you're looking to solve? All these questions are very important. Now, let me give you another example, and hopefully this is clear. Consider the difference between a shallow network and a deep network in predicting patient outcomes. A shallow network, meaning not too many layers, might identify that an elevated WBC count correlates with infection risk. And we know that white blood cells high, that might signal there's an underlying infection perhaps. But a deep network might learn that the pattern of white blood cells elevation over time, combined with specific vital sign, blood pressure, and medication history, creates a much more nuanced picture of infection risk. So a more complex and a more detailed and deep network can probably bring in a lot more variables, and that might mean that it will be more of an expert physician than a shallow network. And the more information you have, the more likelihood that you might come to better conclusions. So the architecture determines which of these patterns the model can detect. Can it detect just simple patterns, or is it also able to detect more detailed and complex patterns? Okay, neural networks. This is the foundation, my friends. So neural networks consist of interconnected neurons arranged in layers, and they process information from input to output, mimicking how our brains process information. Input layer receives patient data, age, lab values, symptoms. Then hidden layers process and transform the data, detecting patterns, and the output layer produces predictions like the diagnosis or risk scores.